Welcome, everyone. Thanks for joining. I'm Dr. Jennifer Pfeuffer, core faculty at Bastyr University in San Diego, and I have a very special guest with me today. We have Millicent Sykes, and she is a graduate of our Masters of Arts Counseling Psychology program. Let's see, that a year ago, right? So that would make you a 2021 graduate. And we're happy to have you today to just talk about your experience as a student, where you are today, how the program has prepared you for the clinical world. So welcome. Glad to have you.
Glad to be here.
So we can just open up. This is kind of an informal, casual conversation, and we can just kind of open up the talk with your experiences in the program. So, and it's a 2-year program. So perhaps there were really memorable moments for you that stood out, classes, anything that really helped you kind of solidify your plans to be a counselor.
Sure. So my experience was really great. I enjoyed the way that the program was structured. So started more broad and then started to go into different areas after that, such as addiction, trauma, the different theories, and we went over a lot, which was really nice. I like that it focused on not just the mind, so not just what psychology is often known as like a study of the mind, but more so the body as well. So kind of tuning into the mind, body, and emotions. I will say a part that I didn't necessarily like was COVID and my second year being virtual. And the second year of the program, we go a lot deeper and heavier. And so the material is naturally heavier, and so being on the screen for like 4 hours every day in the evening learning about things such as sex trafficking or other things like that, it was just pretty heavy, but as is the life of a counselor, it's pretty heavy. People experience a lot in their lives, and I think the program really helped to not only acknowledge like my own life and what had happened, and is continuously happening as I continue to grow, but also seeing how that can relate to another person, to kind of add that more human feel, which I think Bastyr focuses on a lot. So not just seeing one type of person, but more so seeing the variety of people. So overall, I really liked it. Ideally, no more pandemics, please. But the teachers are great. A lot of them are in the field or have had experience in the field, and so having that knowledge is really helpful.
Thank you. You were talking a little bit about the mind-body connection and how many of the classes at Bastyr are tailored to, again, look at this like integrative approach, whole person healing. Can you speak a little bit more about that in terms of your experience as a student in our clinic? So starting out there, and what that looked like for you, and kind of, again, that whole person focus, and then your practicum experience. So if you could talk a little bit about just some clinical work that you've done while in the program.
Sure. So I think usually in the clinic, we get to see clients in person, and there's a way that we're monitored so that we can get feedback almost immediately. It looked a little different because once I started clinic, we were virtual. And so we used the platform so that everyone could hear what was happening, and then give us that feedback immediately as well. I think the part that comes up in terms of mind-body connection was being able to focus on not only what the person, the client, was saying, but also seeing how that came up in their body. So oftentimes someone would say, "I'm fine, like all is well," and then their body would kind of show like they're holding something. Whether that was frustration, stress, sadness, anger, confusion, just seeing that, okay, like we can also hear the messages coming from a client by not just focusing on what they're saying. And I think that was very much preached through Bastyr, hence it's a naturopathic medical school, so it makes sense that they're going to focus on the body as well. My practicum experience is, I don't know No, yeah, I'm gonna say it. It's pretty unique. So I was at a psychiatric hospital that focuses a lot on like high severity and I think it's acuity in terms of like psychiatric disorders. So we saw a lot of people with severe substance use, severe displays of schizophrenia, bipolar disorder. We saw people at their worst, to put it lightly. And so with that, there could be a patient kind of screaming at us, attempting to hurt themselves or someone else. And if we just focused on what they're saying, it could be pretty hurtful. And as a professional, you kind of have to mask a little bit to be that grounding force for another person. And so rather than focusing on what they're saying, we'd focus on their bodies. We'd focus on the emotions that were coming through in the words, and oftentimes that would help to de-escalate the person. So by being with Bastyr, it helped me to just not see psychology as like this mental conversation, I guess, and more so saying, okay, this entire person is attempting to tell me what they need, and I have to be aware of how that's being communicated.
I love that. And that is so important to view again, all the functions of the behavior. What is it telling you? Again, looking at not just the mind and the psychology behind it. So that's wonderful. And then where are you now? What are you doing with your education, with your experiences? Yeah, give us a little bit of an update.
Sure. So I did stay at the psychiatric hospital, and I was a substance, well, it feels like so long ago, but it really wasn't. I was a addictive disorders counselor. So I did that for, I want to say, almost 6 months after my practicum. I personally decided to leave the hospital because as a new therapist, it can be pretty easy to burn out. And while it gave me this experience and information, I want to see how it was to go deeper into the process rather than more crisis management. So right now I'm at a private practice, still in San Diego. I can work with children, but right now I'm working mainly with adults, young adults, teenagers, couples, and families, focusing on symptoms of anxiety, depression, attachment styles, and just family dynamics in terms of what it means to be a teenager or child growing up now. Often reminds me of how I was in high school and junior high, and I'm just like, okay. All right, I see it now. And then kind of seeing how I can help and guide other teenagers, young adults, parents, kind of going through similar situations, and also new situations that I'm not aware of. Yes.
That's fantastic.
Okay.
It does. Congratulations on your newer position, and wonderful. That's great that you get a little bit of experience in private practice as well. How about some long-term goals for you? Can you see yourself staying in private practice? Do you want to expand to other settings, populations?
Yeah. So I do like private practice right now. It's technically a group practice. So rather than just working by myself, I work with other therapists, I guess. I mean, we see our own clients, but we kind of work conjointly, I think is the word. I think long term, I do want to get my PhD. I'm just going to be in school forever, I guess. My desired population are athletes, because I am personally an athlete, former and currently, I guess. And I think it would take what I learned from Bastyr to another level in terms of being able to read not just a body, but a body that is attempting to work at its like optimal performance, and just the stress that comes with that, which can be intense. And so ideally that's that. I do like research. It's a different way to look at human nature and other people. And I've also been TAing for a couple of classes. So long down the line, we'll see how much energy I have and what's going on. I would like to teach, to kind of share the knowledge that has come about. But we'll see. Right now, I'm just focusing on right now. Things may change,
Yes, and they always can. And you're definitely in a good spot right now to focus on your short-term goals and then have some long-term goal focus as well. So it's great. Um, one thing I was wondering about as well, as we kind of have a few minutes left, self-care. So you already kind of talked about that, the importance of it as a student, as a new counselor. What are some things, what are some suggestions that you can offer in terms of how to keep that level of self-care optimal so that you're taking care of your needs as well in this field?
Yeah, so self-care is a tough one. There are certain clients that self-care is difficult because humans can be very unpredictable in terms of what they bring up, and also how me as a counselor, I relate to what they're saying. And so oftentimes I attempt as much as I can to have a strict routine. And sometimes that routine becomes boring. Like it's so routine that I have to switch it up. And so I kind of focus on like the basics. So like have to eat, drink water. I now need a cup of coffee every day that I see clients, and then exercising. So for me, those are things that like I need to feel like the most grounded and able to function. But then with that, I also need to be around other people who aren't therapists or who are not also studying psychology. And also people who are able to respect my boundary as a therapist. So not to kind of vent or unload their current challenges, because my mind could easily go into that therapeutic mindset. And oftentimes I just don't do it, which can feel very cold and hard, but I have to do it. So like, dude, that sucks. Okay. Like, let's go to the beach, let's do something else. So kind of maximizing fun outside of work, which is so vague and depends on what's happening. So focusing on the foundation, the basics, and then adding some playtime as well, which often disrupts my routine, but it's usually worth it. So.
Worth it and needed. Yes.
Yes,
That's
needed. Yes.
definitely good. I love that you highlighted the importance of the foundational things we need to do for ourselves: the sleeping, eating, connecting to community, having those boundaries, especially with your career, knowing when to kind of pull back and not go there. And yeah, also kind of hanging out with people that aren't in the field, getting different perspectives and being able to let loose a little bit, because absolutely there's the tendency in our field to burn out or to take our work home with us, or as you mentioned, kind of slip into these patterns of being, there for everyone to the degree that is too much. And again, knowing when to pull back. So yeah, I think that that's fantastic. And it sounds like you are doing so well in your current work and focusing on those short-term goals, and really taking a lot of what you learned from Bastyr's program into your work and into your world. So that's fantastic. Millicent, I want to thank you for being a part of our conversation today and for coming in and offering your perspective as a former student, now graduate, and now counselor in the field. So always proud of you, always wonderful to see you. For those of you watching who want a little bit more information on our program, please visit Bastyr.edu and find out more about our master's program in counseling psychology. And again, special thank you to Millicent for joining us today, and everyone take care. Thank you so much.